Ethics Case 5, Veronica, Nicole, Amber, Samantha. Step 1. Recognize and define the ethical issues. John is a third-year DPT student on his last clinical rotation at a long-term care facility in the subacute unit. John evaluates a 73-year-old male named Walt who has limited rehab potential and could not participate in the full examination. Walt was assigned a high RUG, which is Resource Utilization Group, category, which involves him participating in a minimum of 120 minutes of PT per day. A Resource Utilization Group is required by Medicare for patients in skilled nursing facilities. John believes that this is an error and confronts his clinical instructor about this. His CI informs him that this is most likely isn't a mistake and explains to John that patients with similar conditions and diagnoses are put on high RUG levels due to an increase in reimbursement rates from insurance companies. The CI suggests that John speaks with the department supervisor who assigns all the RUG levels at the facility. The department supervisor states, "Don't worry, just break the minutes up throughout the day. You can see Walt all day long." After 2 days of participating in this RUG level with Walt, John noticed Walt's condition is deteriorating and that physical therapy appears to have a detrimental effect on him. We will follow the realm individual process situation model of ethical decision-making in order to properly solve this issue. The individual, John, and the organization, the long-term healthcare facility, are both affected by this issue. Moral sensitivity. John recognizes that the facility is violating the code of ethics. Moral judgment. As a student physical therapist, John realizes this situation is unethical and he should act upon it. Moral motivation. John decides to take action even though it could jeopardize his relationship with his clinical instructor and jeopardize his clinical rotation. Moral courage. John approached his CI and the department supervisor regarding the unethical situation even in the face of adversity. John is experiencing 2 types of situations with this unethical case. These are distress and temptation. Reflect. The major stakeholders in this situation are John, who is the student physical therapist, the clinical instructor, the department supervisor, and the long-term care facility. The consequences of the situation could be John's clinical rotation could be dismissed, the clinical instructor's license could be suspended or revoked, the department supervisor could lose his job or have his license suspended or revoked, and the facility could be fined, put under investigation, or shut down. The relevant laws that are violated include fraud and abuse. This situation violates the False Claims Act. This act includes falsifying documentation to obtain medical money from the government, ignoring government laws regarding PT services, and billing for services that are not medically necessary. John's duties and obligations include confronting the clinical instructor regarding approaching the OIG or CMS. The OIG is the Office of Inspector General. CMS is Centers for Medicare and Medicaid Services. He is also obligated to contact the compliance officer. Ethical principles include the following. Principle number 2. In this situation, the interest of the organization is being put over the individual patient's needs. The services are not being individualized to the patient, and the PT did not inform the patient of the plan of care, which didn't allow the patient to be a part of his own care. Principle number 3. John demonstrated independence and professional judgment by approaching his CI and supervisor about what he found in the initial examination. Principle number 4. In this situation, the CI and department supervisor are exploiting John by encouraging him to perform unethical procedures. Walt is being exploited due to the RUG level assigned to him that exceeds his functional capacity. Number 5. The CI and department supervisor are encouraging John to be non-compliant with state and federal healthcare laws. The CI is not demonstrating professional behavior by remaining silent. Principle number 7. In this situation, the long-term care facility is preventing John from fulfilling professional obligations. The RUG level does not accurately reflect the nature of services that John should be providing. John's resources include his academic coordinator of clinical education, and he should also research APTA Code of Ethics and Guide for Professional Conduct. After reviewing the 5 tests for right versus wrong situations, We have determined that this is a wrong situation and there is only one right course of action. Therefore, we were able to skip step 3 and continue to step 4. Step 4. Implement, evaluate, reassess. John should confront the CI and department supervisor again, advocating to change Walt's rug category to match his functional levels and needs. John should also provide information regarding the Code of Ethics principles violated in the situation and provide evidence-based research supporting his argument. John's barriers include the facilities department supervisor's decision to disregard John's recommendation for Walt. Also, the possible decision to dismiss John's student position at the clinic. The rug policy should be revised to be individualized to each patient. With that said, we have learned that these unfortunate situations are capable of happening. If this situation goes unspoken or unannounced, organizations may continue this unethical practice or approach. John's strengths were that he was aware that the rug level did not match Walt's functional ability. John was aware of the ethical principles and acts of conduct that needed to be followed. However, John's position as a student PT put him at a disadvantage. John can learn how to go about taking action and how to professionally confront his superiors in the future.